Many thanks for your company. But there is increasing support for the Human Sexual and Ghanaian Family Bills 2021. We know that yesterday was the last day for the receipt of memos in support of the bill. So faith-based organizations in the country have drawn the line in the stand for an all-out war against groups and individuals opposed to the bill. Earlier today, a group calling itself Advocates for Christ briefed journalists on the medical and scientific research which puts the spotlight on the impact of LGBTQ+ activities. Edem Senanu is president of the group.
Now, obstetricians or gynecologists and pediatricians are not allowed, when you are born, to write on your card that you are male or female in some countries. They say you must wait for that child to become of age to tell you that I'm male or I'm female. What kind of nonsense? So doctors are not allowed to work. Then we have gender dysphoria, those people who cannot make up their mind, whether they're male or female. They have anxiety, they have depression. Meanwhile, because of the so-called conversion therapy, they say that doctors should not tell you that, oh, you are depressed. They should just affirm that, oh, you are okay. It is because you are transgender. If you say they have depression, the laws will arrest you and take you somewhere. So doctors, medical professionals, health professionals in these countries they are not at liberty to offer professional medical advice. Because if you do, they will accuse you of promoting conversion therapy and get someone to come and arrest you. So you can't even advise them when you see that, oh, it's depression or it's anxiety. Because now we say homosexuality is normal. We have voted and thrown it out of the American Psychology Association's book, and now the whole world must follow America and something crazy. And there's child sex abuse. The research also shows that most of them experience sex abuse. And that's what has made them who they are in childhood. And then they repeat same. You see, where the Genome Project said that 75% of what contributes to your sexual orientation is based on your environment and culture. So if in your environment you were sexually abused, your sexual orientation towards your children will emanate from what happened to you. Are you with me? So that's the logic in the science. So the science has shown that for most homosexuals, they are likely to replicate and visit the same type of experiences they've gone through on their children, on young people in their environment. Keep that in mind. Let's look at the data. The ratio of physicians per 1,000 people in Ghana at the moment is 0.1. Number of physicians per 1,000 people is 0.1. Compared to 2.6 physicians per 1,000 people in the UK and 2.8 physicians per 1,000 people in the US, you have 0.1. It's not 1 yet, too. 1. You want to embrace these issues. We also have a low overall national hospital bed capacity. Our total bed capacity is 0.9 bed. We haven't got 1 bed, though. 0.9 bed per 1,000 people. In the UK, it's 2.5 beds per 1,000 people. And in the US, 2.9. You have 0.9. Keep that in mind. The medical and psychological impact is grave. It's affecting everything, including the medical systems in the countries where they are promoting this and allowing it. In those countries, medical doctors are not allowed to engage their patients, diagnose and treat them in a manner consistent with their expertise. They are forced to embrace this inclusion ideology. So for social reasons, let's just accept everybody. Let's all be quiet and allow it. Let's not tell them that this is just anxiety. This is just depression. No, don't tell them. Just tell them you are okay. The mandate being pushed by the current US government in this area is being challenged by the Alliance Defending Freedom on behalf of the American College of Pediatricians, as well as the Catholic Medical Association and other individuals. So this thing that is going on, for example, in the US, is being challenged. The gender inclusion package is holistically dangerous. Let me say that. It's holistically dangerous. I want to say we are embracing everything. If embraced by Ghana, our nation will slowly arrive at the levels of chaos that we can see, or anarchy, in other healthcare systems. Our healthcare system already needs a boost. We must learn our lessons from the other jurisdictions that this is being practiced. and make sure that we protect our populace. In conclusion, contrary to the views expressed by the LGBTQI persons, proponents, assigns, agents, and what have you, sex is binary, and it is scientifically assigned at birth by the presence of male or female genitalia, but not just that, by the issue of your chromosomal composition and your hormonal levels. All of that forms a basis of deriving and arriving at who you are, whether male or female. Not just a physical observation of whether you have a male organ or a female organ. Again, in conclusion, after studying 500 million citizens of the earth, the largest single ever research work the Human Genome Project has established, there is no evidence of any gay gene. And to that extent, if there is no evidence of a gay gene, there is no unique case to argue for anything such as a gay basic right or a gay fundamental right. The over 64 terms and counting that describe various sexual lifestyles or orientations are unscientific ideologies or concepts that people have come up with no basis in research. There's no scientific research backing them.
That's Edem Senanu there at that press conference a while ago.